Welcome to the television edition of Radio Friends, where we feature guests from all over central Missouri. This week, we're going to talk more about antibiotic resistance and native plants with Nadia Navarrete Tyndall. All that and a lot more. So let's get started right now. We got an old friend of mine. I haven't seen him for a little bit, but he's worn many hats over the years that I've known him. This is Sean Spence. And today I'm going to introduce him as a Regional Director of Community Relations with the Salvation Army.
That's right, Paul. It's so great to be here with you.
Yeah, it's good to have you here, too. I remember when you were with the City of Columbia Better Business Bureau.
Yeah, Better Business Bureau, KOPN Radio.
Yeah.
I've talked to you about MS. I've talked about all kinds of things.
Everything. Now you're here with the Salvation Army, and that's a wonderful organization.
That's right. Well, anybody talking about anything important to the community needs to come talk to you.
All right, thank you. But the Salvation Army, they do so much for this community.
Yes, sir.
So many people depend on the Salvation Army.
Yes.
What is going on right now?
Well, there's a lot going on. I mean, as you might imagine, one, we're starting to head into Christmas. And in fact, really at the Salvation Army, this is the beginning of our Christmas season. Started October 1st, which, we're not even at Halloween yet. So it's a little bit weird to say that, but it really is the case.
So the red kettles aren't out yet?
Not out yet, but they're going to start coming out in November. And they'll come out just before Thanksgiving.
Okay.
And then they'll be in through the end of the year.
Right. So is there a goal set yet for this Christmas season?
We have not yet announced a goal. That's still getting hammered out. It's going to be a big one, though. I mean, it's several $100,000. We did well last year, but there is a lot of need. And as we all might guess, COVID has given us a lot more need.
Yes.
Honestly, the poor, for the most part, got poorer, and the need got bigger thanks to the pandemic.
Yes. Well, I mean, that's no secret. And so many people would have no place to even stay warm if it were not for the Salvation Army.
That's
the Harbor House
That's right.
is there for people to provide a safe shelter, to stay warm, to provide a meal. There's so many things the Salvation Army does, but it needs our assistance. If you can help out at all, Sean, what's the best way to do that?
Really, the best thing to do is the Salvation Army, and this is the case. I know people are watching you all over the country and maybe even all over the world. We're in, it's like 88 countries the Salvation Army is. So really wherever you are, whether it's Columbia or Ashland or Jeff City or St. Louis or Timbuktu, you pretty much can just go Google Salvation Army and you'll find a local number, or at least a close
local
number.
Chapter, right.
And so what you want to do is just go and Google Salvation Army. You'll immediately find us, or Salvation Army Columbia, and you'll find us. And what you're going to find is a way to help. You're going to be able to find a way to donate, but you're also going to find really interesting ways to get involved if you want to. We're not, the shelter is so important, and we do that a lot of places all over the country, but we also provide so many meals separate from who's in the shelter. Anybody. Paul, if you were super hungry, you could go to the shelter and you would get fed. We feed people who desperately need it. But we also do coats for kids, and we do, during Christmas, we do such a fun thing, which is going to get started here in the next couple of weeks. We do the Angel Tree, where people at little stores all over town are going to find a place where they can get hooked up with a family with children who need gifts, and they can buy gifts and leave them under the tree, and then we'll make sure they get to the right families.
Wonderful. Yeah.
It's so wonderful.
Okay. Are you looking for volunteers also to help ring the bells?
Absolutely.
Thank you so much, Sean.
Thank you,
Good
Paul.
to have you here.
Thank you.
Okay, now we're going to talk about how you can save money on Medicare. And Scott Mania is with us. Scott is an expert with the claims program. And actually what you do is you will analyze people's needs and then recommend what is best for them. You're not trying to sell anybody anything.
That is very true. Yeah, if you turn 65 or if you are over 65, you get a Medicare and You book every year mailed to you from CMS, the Center for Medicaid Services. And if you look on the back, It says, call this number for personalized health insurance counseling. It says, ship for Missouri claim, and it has our number on it. So almost everyone who has Medicare in Missouri has access to that handily. But basically, one of the things that's important is it's open enrollment now, right? So
Yeah.
this is the time you can do your annual checkup on your Part D coverage. And although we're here to help you all year round, for this particular piece of Medicare, this is the time to make that call.
Okay, what is Part D?
Part D for drugs. It's the prescription drug plan that you will opt to look into to pay for your medications. Now, some people have a Medicare Advantage plan that has a prescription drug component also, so that would be tangential, but yeah. So if you have a Medicare Part D drug plan now, and you're happy with it, it might be just fine, but because your health changes and the plans change and what's in network and what prescriptions are covered change, it behooves you to give us a call because we can then look at all the options. And although the plans are motivated to compare options among their offerings for you, we will look at all of them that are available, regardless of the provider. We're
Okay.
unbiased in that way.
Now, I see these commercials on television, and it says, in fact, I saw one last night. You may be eligible to have $144 returned back to your Medicare check and get $1,000 of free dental, $1,000 of drugs, at no cost to you. Is that true?
It can be, yes. It depends on, it's all in the details. Like many things, you have to read the fine print and ask a lot of questions.
And
However,
you have to qualify for it, right?
no, not generally. It depends on which thing you're looking at. Obviously, I'm not an expert on every Advantage plan, but what you see often is a supplemental benefit that the plan is offering to entice you to pick them for your Medicare coverage rather than traditional Medicare. But really, with Part D is the big place where we can help people save a lot of money. And in fact, our volunteers, we've just pulled some recent numbers. We have 1,257 years of experience among our volunteers in Missouri right now.
What is SEDIF?
Yeah, C. diff is a
C. diff.
yeah. It's kind of a tricky word. It's a bacteria that has grown resistant to antibiotics, and it infects your intestines, and it can be deadly pretty quickly. A lot of people die from C. diff a year. It's a non-reportable disease, so we don't know the full impact of it, but it's generally caused by antibiotic overuse, and it's also antibiotic resistant at times.
Now, this is something that you and your daughter almost died from?
Yes, that's correct. So separately, I had an infection in 2011 and she had an infection in 2013. And it was very bad for both of us. Our infections were very tricky to get rid of.
Now, as an advocate to prevent the overuse of antibiotics, what are you doing?
So I want to always use them appropriately. Antibiotics save lives without a doubt. They are so instrumental in our healthcare, but we use them irresponsibly. You know, we use them for a cold or virus, which are totally unnecessary. They won't do anything for a virus. We use them as a preventative measure, and a lot of times you don't need that either. And I also, you know, for me personally, I try to take care in my house. I don't use a lot of disinfectants. Instead, I use soap and water because disinfectants, yes, they do kill germs, but 99.9, so the 0.1% are infections and bacteria like C. diff, which is in what I got sick from. So when you're killing all the bacteria in your home from cleaning, that also kills the good germs and makes the bad germs sometimes stronger.
And that's something we don't think about a lot, is there are good germs and bad germs, and we need those good germs.
Yes, yes.
Now, you were also, we were talking about the fact that we say that we are becoming resistant to antibiotics. It's not us that's becoming resistant. It is the bacteria that is becoming resistant. It is learning how, and it's very intelligent, isn't it?
Very.
And it can mutate. It's learning how to work around the antibiotics when we're using it so often.
Right. And that's exactly true. So if I take a lot of antibiotics, but you don't, you can still catch a resistant bacteria because of inappropriate use from other people, because this is a problem for everyone. And that's why we need to collectively get together and change how we use things. I think of the cancer patients who are so vulnerable, and antibiotic resistance for them is extremely dangerous. And so we need the antibiotics that we have to work every time. But this inappropriate use makes these bacteria stronger and stronger, so that people like you and I, people that have compromised immune systems, are having a really hard time fighting these infections because it's not working anymore.
You said something else that I didn't realize either. You said even if I am not using a lot of antibiotics or not using them inappropriately, I still can be affected by a antibiotic resistant bacteria.
That's true. So if you caught an infection, it could be an antibiotic resistant infection. My son just had an ear infection that was antibiotic resistant. So you have to go to stronger drugs, higher power. And so, it wasn't his fault per se that he got an antibiotic resistant infection. They're just out there everywhere.
Don't you believe now that this has been, it's been in the news, more people are aware of it. Don't you think more and more doctors now are saying to their patients, even if the patient asks for it, maybe you don't need that right now?
Yes.
Because I know people will go in and say, oh, I've got a cold, I want an antibiotic, give me something for this. And perhaps in the old days, the doctor, instead of just arguing with the patient, would say, okay, but I think they're changing their attitude on this now.
Yes, the CDC has implemented a lot of antibiotic stewardship programs, and just, training doctors to really look for signs on if that patient needs an antibiotic or not. And also us, as patients are becoming more aware that when we're taking these drugs, like, it is affecting our gut flora, which is where our immune system is, and it's contributing to this issue. So I think both parties working together, just be mindful. Everybody, the doctors, the patients, the caregivers, all need to be mindful about antibiotic use and whether or not it is necessary.
Sometimes you're feeling sick or you've got a cold or something just isn't right. If you give it a little time, there's a pretty good chance that the body is going to heal itself without intervention.
Absolutely.
Now, that's not saying that you shouldn't go to the doctor. I'm not saying that at all. But most of the time, the body is going to heal itself.
Yes, and that's why you want to have a good relationship with a doctor that you trust, where you're both kind of on the same page as to whether or not an antibiotic is necessary. And you can do watchful waiting. Talk with your doctor. Do I need this antibiotic now, or can I wait a day? And just see how it goes.
Yeah. If people want more information, is there a website they can go to?
The CDC has so much information about antibiotic stewardship and awareness and appropriate use. So if you do just a simple Google search about antibiotic resistance, you're going to find a ton of information, and from a lot of credible sources out there, like the CDC, the Mayo Clinic, and other sources.
Okay. And obviously, if they would like to email you and start a conversation there, your email address is?
thestonewinters@gmail.com. I'm happy to help anyone through this.
What do we know about paid leave?
Well, those folks who have jobs that offer it don't even think twice about it.
Right. You just think that, oh, this is one of my benefits, it's my right, and everybody has it. But everybody doesn't have it.
Right. In fact, there's quite a lot of people who do not. It's just not provided. And I say it's something you take for granted if you have a job that provides that. But if you don't, what kind of roadblocks it presents? If you are a parent of young children, if your children get sick, can you take time off to care for your children? Or if you have no paid leave, then you have to go to work. So it is a concern for many people, and rightly so.
Do you know the percentage of people who are actually out in the job market who do not have paid leave as a benefit?
I do not know that percentage, but I believe it's quite high, actually. It's probably more surprising than we might think. Millions of people.
What are you trying to accomplish with the Lunch and Learn?
Well, what we are doing is the League of Women Voters traditionally studies various public policy issues, and this is one that our Kansas City League has taken up and done a study of paid leave in Missouri. And they're going to present their findings at our Lunch and Learn on November 9th at noon on Zoom.
Mm-hmm.
And
So it'll be on Zoom.
Right, it'll be on Zoom, and they will share their findings about, in Missouri, what are the statistics and, what can we do? How are there ways to ameliorate the situation? Would it be through legislation or other public policies with corporations, different companies, to encourage them to provide it? So this will be an opportunity to hear about their study and also, to learn about it and then perhaps to take action.
Okay. So if people want to be a part of this Lunch and Learn program, what do they need to do?
They would either go to our website, lwvcbc.org, or the library's website, dbrl.org. The library is a co-sponsor, and there will be a place to register for this program. It just takes a moment. You put your name in, and then you get a link for the program.
So who will be speaking?
Some of the members from Kansas City League who have done this study, and they will be presenting.
And will they present information on what people can do to try to bring paid leave to everyone?
Well, I hope they will have suggestions. I don't know really the text of what they're going to say.
It's not that simple.
Right, exactly.
It's a complicated issue,
Right,
and it's not
right.
something that's going to be accomplished overnight, but at least you can start talking about it.
Exactly.
All right, Marilyn McLeod, thank you so much for coming by.
Right.
And
Thank
please
you.
come back and visit us again, and hopefully you'll be able to do those Lunch and Learns in person pretty soon.
That would be lovely.
Next year.
Right.
Next year.
Right.
Okay?
Thank you so much.
You're welcome. All right, now we're going to talk about memory, how to improve our memory. How many times have you forgotten something that you did a couple of days ago, but you can remember 15, 20 years ago? Well, Danielle Winton is with us. She is the founder of Memory Strategy. And you said there is a way that we all can improve our memory.
That's right.
And how is that?
Well, there's a lot of different techniques and tricks and tips that people can use that people just haven't been taught, right? Have you ever had a memory class before?
No.
No. And so people just don't know what they're capable of. So I teach people how to learn, how to study, how to remember, how to recall, how to retain information, how to soak up information. So they're just skills that a lot of people don't even know exist.
Can you give us an example here?
Yeah,
Okay.
sure. So let's say you want to remember someone's name. You meet someone at an event, his name.
Oh, that's what I'm bad at.
Right.
I am
Everyone
very
says, how do
bad
I
at
remember
remembering
names?
people's names. I can remember faces, but names just go right by me.
Exactly. And there's a reason for that. Names are very common. And so our brain is constantly filtering out important information versus not important information. So a name like Brian might not stick in our brain. So we have to be active in getting it to stick. So an example of that would be, how can I create an association or link it to something that's already in my brain? So an example would be Brian in my brain sounds like die and yam. So I make something that rhymes with it. So now I've got a crazy picture in my head, so stick with me. So imagine you meet this guy, Brian, and what is he doing? He is dyeing yams a different color to be purple and yellow and blue and white. And so now you've got this weird visual of him doing something crazy, but it rhymes with his name. And so now you're more likely to recall his name because you've spent time associating it with something else that's already in your brain.
But what if you remember his name, but you can't remember his face? you got to put the face with it.
Right. And so
And
when
normally it'll do that.
Well, when you're intentional about meeting someone, right, instead of being distracted and thinking about what you're going to say, looking at them, looking at their facial features and taking that in, soaking that in, being present in the moment, that will really help you.
Okay. How about remembering where you put things. That's something that happens to me now.
Yes. Well, I will say this. So there are memory experts, people in the Guinness Book of World Records who have memorized large amounts of information, and even they forget where they put their keys. So it is perfectly normal to forget where you place things, but of course there's little tips and tricks we can do. So having a routine, putting them in the same place all the time. And if you don't remember, there's actually a really interesting study that says when we go in and out of doorways, whether physically or in our mind, it helps us recall things. So you think about, oh, I just went into a new room. I can't remember what I was going to do when I came into this room. If you go back to that other room, you're likely to remember. It serves as
Really?
an event boundary. It's fascinating.
Okay, because sometimes I will go down to the basement for something.
Mm-hmm.
I'll get down to the basement and I'll say, what did I come down here for? I can't remember. But you're saying if I go back up the steps
You're more likely to remember.
and go back to where I started, I'm
Mm-hmm.
probably going to remember what I was going down to the basement for in the first place.
Mm-hmm.
Okay. If people, obviously we could go on and on with this, but if people want more information on how to improve their memory, how do they get in touch with you?
Sure. If you go to my website, it's memorystrategy.com. All my contact information is there. I've got email, phone number, text, anything like that.
Okay. So it's www.memorystrategy.com. We were talking before we came on, and Nadia always says, don't clean the garden right now. Let the garden stay over winter for the environment.
Yes, and yes, I want to make an emphasis and urge people not to be so eager to clean every single leaf from the yard. I'm not asking people to not to touch your garden. You need to clean some areas. And I'm talking about an urban yard, but there are places where you can leave your leaves, you can leave your dry plants standing in the winter, and that will provide habitat for pollinators. And I brought a few ideas for people also. This time of the year, besides leaving your garden alone, you can do some plantings for next year.
Okay.
And we have this right now. We still have a few flowers that are blooming.
You brought some pictures along. They look like little purple sunflowers.
That's right. They are all related to sunflower. Right now, these are the most abundant group of plants.
Yeah, I've got those just running wild in the fields.
Yes, asters. We have so many species of native asters. The one in the picture that I brought is a purple aster, is New England aster. They can also be pink, but we have diversity of asters. And another group that is very common right now is still with this mild weather. We still have lots of flowers, is the goldenrods.
Okay, goldenrod.
Yes, and goldenrods, we need to remind people, for those of you who are still saying that goldenrod is a source of allergies, it's not.
Goldenrod is not a source of allergy?
No. What it is, well, some people might be allergic to any flower, but goldenrods are not the ragweed is the plant that is usually that usually causes allergies.
And ragweed's a pretty flower too.
No, actually, ragweed is a very tiny little flower, nothing at all.
Oh, well, then I'm probably calling goldenrod ragweed.
Probably. It's that I brought you the sample because, I mean, I understand I'm a plant person. I learned the plants, but not everybody knows them. So if anybody has any questions, just let me know and I can help you to figure it out.
Well, I've got, which I have been calling ragweed. They grow about 4 or 5 feet tall, and they've got beautiful little tiny yellow flowers.
Yeah, those are your goldenrods.
That's goldenrod.
Probably tall goldenrod, or it's just like a tall goldenrod is one that is very common. Nobody needs to plant it; it's always there, but it's so good for pollinators.
Okay, so that's not ragweed. That's not what you're sneezing real bad with.
That's right.
All right, you brought a couple other pictures that we can look at here in the studio. Is that one kind of purple pink one, is that milkweed?
Well, yes, this is a purple milkweed that can grow in shade
shaded areas.
I've got those.
So that's wonderful because it's one of the most delicate and beautiful milkweeds. But the purpose for me to bring these pictures is to show you the diversity of insects. These pictures were taken in my yard, in our yard. And so because we have so much diversity of plants, we have diversity of insects. At the same time, one important thing to know, and it's why I am urging people to leave some of their debris and their leaves, because insects like bumblebees and wasps and or like beetles, they hibernate as adults in gardens. So they need those leaves to hide during the winter.
Okay. Now, you mentioned wasps. What are the benefits of wasps? Because they sting, and they really hurt when they sting.
If you leave them alone, they won't sting you. They are defending their babies. And of course, there are cases when you just have to deter them if they are close to your house. But wasps, believe it or not, are also good pollinators.
So the wasps are good to have around.
And they are also predators. They could kill some of the pest diseases that affect some of the vegetables, might be controlled by wasps. So they have a purpose in ecosystems.
All right. I'm glad you said that because I never did like wasps. But now I would look at them more kindly because they are killing some of the bad insects and they're good pollinators.
Yeah, one particular example is a very tiny wasp that lay eggs on the thorn. I'm sorry, I forgot these tomato hornworms.
Yeah.
They can deter your tomato plants. I mean, kill your tomato plants, but these little wasps lay eggs on the caterpillars and they control them. So also they are doing a service to you.
Yeah, those hornworms on the tomatoes. I remember they devastate the tomato plants. And Nadia was over at my house at one time, and I was pulling them off and killing them. She goes, "No, don't kill the caterpillars." What are you talking about, Nadia? They're devastating the tomatoes. But what's the purpose of them?
Well, the purpose of them is that the birds can eat. They can eat them.
Yeah.
Birds need worms. Usually, caterpillars. Usually, the baby birds, maybe not these big, huge hornworms, but the little caterpillars that they find in every plant, from oak trees to wildflowers, they feed their young.
Okay. All right. Well, they can come over and feed their young off of the caterpillars on my tomato plants. No problem. They're more than welcome to do that.
No.
All right. We're almost out of time. If people want more information about all of this, you're very informative and very entertaining, Nadia.
Well, thank you, Paul. And I'm glad you
If people want
agree.
more information, what can they do?
They can check my Native Plants and More Facebook page, and also they can contact me at at my email at Lincoln University. And we're getting ready to offer what we call the Native Plant Academy next year. And we're gonna have I'm gonna put that information in the Facebook page.
Okay, so you can go to Navarrete-Tyndall
And
at
LincolnU.edu.
LincolnU.edu. All the information you need, and you're going to have that academy next year.
Yes.
Okay. Nadia, thank you so much for coming by. Always a pleasure chatting with you.
Same here, Paul.
Okay, and I'll try not to kill. I pulled one off just the other day. They're still going. All right. Drop me an email, pepperp@missouri.edu. Bye-bye.